Methylmalonic acid, also known as MMA, is a urine test for vitamin B12. Increased methylmalonic acid levels indicate a vitamin B12 deficiency. MMA is elevated in 90 to 98% of people with a vitamin B12 deficiency, excluding people over 70 years old. Serum ferritin is a very good test. Ferritin is a blood cell protein that contains iron. This test is used for iron deficiency or iron overload diagnosis. A ferritin test helps you understand how much iron your body is storing. A serum blood test checks the clear fluid between the cells where nutrients have no function. The area outside the cell does not generally reflect the nutrient status of an individual. It reflects the current diet. This is not a good test for checking long-term nutritional status. It is a good test for checking your current diet. A functional blood test is really the best way to go. It uses live white blood cells, known as lymphocytes. It checks for functional abnormalities over a 6-month period. It has the highest rate of accuracy for long-term nutritional status. Advanced medical students learn this test after they graduate medical school if they go on to study further. The process that functional blood testing is done is quite fascinating. They separate out white blood cells. They put some in a nutritionally complete medium. They measure the growth rate of those cells. They will determine an individual's growth rate. Note that a young person's growth rate will be faster than an older person's growth rate. After they determine that individual's growth rate, then they'll take more cells out, put some in a complete medium minus one nutrient. That one nutrient will be the nutrient that they are testing for in that petri dish. And they measure the growth rate again. They'll be able to tell by measuring the growth rate if those cells were either deficient in that nutrient, had an adequate amount of that nutrient, or perhaps are borderline deficient of that nutrient. And they do this again each time for every nutrient. It's called micronutrient testing, and it's offered by Spectracell Laboratories. Here's a list of everything that the micronutrient test by Spectracell Laboratories covers. You can see all the vitamins here, some very important minerals, amino acids such as serine and glutamine, which are sometimes found deficient, and asparagine, which is often deficient in people with autoimmune diseases. Then you have oleic acid, an important fatty acid, many antioxidants, which are very important in the body. They can check your carbohydrate metabolism by putting some of your cells in a dish high in fructose and seeing how your cells handle the high amounts of fructose. They check for metabolites such as choline, inositol, and carnitine. They check your immune index by subjecting your cells to a pathogen and seeing how your cells respond to it. And then there's the Spectrox, which is testing your total antioxidant function. The Spectrox test measures your cell's ability to defend itself against free radicals. And what they have found doing this test for many years with doctors all over the country is that if a patient takes a high dose of a single antioxidant over time, it can cause the exact opposite effect of what the person is trying to achieve. Instead of it achieving an antioxidant effect, A high dose of a single antioxidant supplement can cause an oxidative effect. So if you supplement, it's suggested to take a balanced antioxidant at low dose, one that has several different antioxidants and not just one. After many years of SpectraCell laboratories using this test, they have come up with average results. Only 8% of all people tested come up without any deficiencies. Over 30% of people tested have a zinc deficiency. Over 20% of people tested have a folate, selenium, or a vitamin D3 deficiency. 22% of people under the age of 75 come up deficient in vitamin B12. But only 10% of people over the age of 75 come up deficient in vitamin B12. Can you guess why? Unfortunately, it's because a vitamin B12 deficiency can cause death. So these are the 3 common ways to test for vitamin B12. Methylmalonic acid, as we talked about earlier in this video, very accurate for people under the age of 70 years old. Serum vitamin B12 test, which has a very low rate of accuracy for actual nutritional status and is an outdated test. And then there's the functional vitamin B12 test, which looks in the white blood cells, which has the highest rate of accuracy for all ages. The micronutrient test by SpectraCell Laboratories has been used by the Hippocrates Health Institute in Florida for many years. It's available at any Lab Test Now locations throughout the United States. Also available online at rawfoodsbible.com, where you can have the kit shipped to your house and use a local blood draw site. Very convenient. Telomere testing is another very good tool that SpectraCell Laboratories offers, also available at rawfoodsbible.com. Overwhelming scientific evidence confirms that vitamin deficiencies are associated with disease processes and the overall condition of one's health. Vitamin, mineral, and antioxidant deficiencies have been shown to suppress immune function and contribute to chronic degenerative processes such as arthritis, cancer, Alzheimer's, cardiovascular disease, and diabetes. This body of research has been reaffirmed by the Journal of the American Medical Association. What value is life if you're not healthy enough to enjoy it?